okay, because they are labially inclined. Okay, remember that. Okay, and we also saw that according to the curve of Wilson, the crowns, okay, of the posterior teeth in the mandible, they lean lingually and the roots to the distal, and in the maxilla, the crowns lean to the buccal and the roots lean lingually. Okay, keep that in mind. And the most, so we're reviewing here, and the most upright teeth in the mouth, according to the curve of Spee, is the premolars. Okay, now maxillary central incisor. Okay, the crown of maxillary central incisor is the widest. Okay, it is the widest measured distally of any anterior teeth, including the canines. So, of any anterior teeth, which tooth is wider, mesial distal? It's the maxillary central incisor. Okay, so high-heeled stuff that you're supposed to know. Okay, all right. I know I mentioned okay a lot, but that's just to make sure that you understand and keep paying attention to these lectures. Okay, so mamelons. We discussed last time that all anterior teeth develop from 4 lobes. Okay, they have 4 lobes and 3 mamelons because the 4th lobe is usually the cingulum. So it doesn't form, the cingulum doesn't form, it's not part of a mamelon. So mamelons are sometimes found on the incisor edge of newly erupted teeth, okay, and have been referred to as evidence of 3 labial lobes, okay. Remember, there are 3 labial lobes and 1 lingual lobe, which forms the lingual lobe forms the cingulum. By the mamelons, when those lobes come together, they form depressions, okay, or developmental depressions, which appear like mamelons. Now, mamelons are not only found in newly erupted teeth. If you want to know that somebody has malocclusion, if an adult has mamelons on the teeth, it means that adult patient has malocclusion, because it means that the incisor teeth are not occluding. Okay, so that's the significance of mamelons. If you see somebody who has mamelons and is an adult, just know that there's some kind of malocclusion. Okay. Now, you look at the picture there, so you can see that there are 3 mamelons separated by labial developmental depressions. Okay. And the maxillary central incisor also shows imbrication lines. You can find imbrication lines in the cervical portion. So in imbrication lines are horizontal lines on the cervical surface of the maxillary central incisor. Okay. So the most common number of mamelons is 3. Side note is that due to the rounding of the distal incisor angle, the most common number of mamelons on the maxillary lateral incisor is 2. All right. Remember, the distal portion of maxillary lateral incisor is you said 2 rounded when you compare to the centrals. So because it's 2 rounded, where you are going to see when we discuss the lateral, the 3rd mamelon, okay, the distal labial mamelon is not there, so you only have 2 mamelons. Okay, that's a very good board question that you have to pay attention to. All right. Now the labial developmental depressions. So further, there are further evidence of separation of the labial lobes of the anterior teeth. Okay, And the developmental depressions, they are usually shallow depressions which are found in the incisor portion of the labial surface, therefore causing mamelons. Okay, and the linear developmental depressions, uh, vertical depressions, they are named according to the position. So you have the mesial, distal, okay, and middle labial depressions. But the middle labial is not there, so you only have the mesial and distal labial developmental depressions. Okay. All right. Still on the maxillary central incisor. So the maxillary central incisor, when you look at it in the incisor view, okay, the crown has a triangular shape. So when you look at a maxillary central incisor in the proximal view, it's triangular shape, okay, and the shape of the triangle in the proximal view, the base is at the cervical and the apex is at the incisor. When you look in the incisor view, the base of the triangle is at the labial, okay, and the apex of the triangle is at the cingulum. All right. The crowns of all anterior teeth are triangular or wedge shaped in the proximal view, as we saw earlier.